along with the physicians. An earlier work of Thomas Eakins was the Gross Clinic, and there was no nurse in it. And so this was painted after that time. You can kind of see some of the advancements in medical therapies and treatments with this painting that came about 10 years after the first one. So, all right, cool. So I'm going to get started. This is just an introductory session to medical terminology. At the end, hopefully you'll know a little bit more about some basics of medical terminology, how to kind of dissect words a little bit when you see diagnoses and medical terms, and where to turn to learn more. It's not a very robust course. It's nothing that is meant to give you fluency in medical terminology, but it's a way to start thinking about it and help you maybe learn ways of appreciating medical terminology, and hopefully getting you more comfortable with it. So I'm Keith Mages. I am the Norton M. Luger Clinical Medical Librarian here at Weill Cornell Medicine. I work closely with Judy Stribling in the Patient Resource Center, and I'm really happy to be here today to talk to you a little bit more about this topic on introduction to medical terminology. So again, medical terminology, it's a specialized language, and it's used by healthcare providers. We've all heard it before. We've seen it online now these days. And learning the basics of medical terminology can help you better understand both your own health, the medical terms that are being used to describe your states of health, and it can also help you converse with your healthcare providers. So that's why we're showing you this introductory session today, to hopefully get you a little more comfortable with the terms that you may be hearing, either applied to you or to your loved ones. Most of the contents of this course have been utilized or have been drawn from the Des Moines University Medical Term course. They have a fantastic freely available online course. For anybody who's interested in it, if this is something you want to explore more, it's much more thorough than this introductory lecture will be. So it's at https://www.dmu.edu/medterms. And if you're interested in that, please feel free to go and check that out. Nope. One thing I do want to do, I just remembered that I was asked to, and Judy, I forgot about that, is recording this session.
I'm doing that, Keith.
You did? Okay, great. Great, thank you. Sorry about that. So going back here again, yeah, I wanted to let everyone know also that this particular session was first developed for an earlier presentation that I did with some colleagues of mine here at Weill Cornell Medicine, Carolyn Jedlicka and Antonio Primo de Rosa. So thank you to them. And again, this is just the tip of the iceberg. What we're going to talk about today is not meant to be comprehensive, but it's the beginning, and we'll give you some tools so that you can progress in the future. All right, so our learning objectives for today. We're going to work to understand the two major types of medical terms. There's descriptive terms and eponyms. We're going to work to gain a basic understanding of how medical terms are constructed, and they usually use three components: a prefix, a root, and a suffix. And then we're going to learn common prefixes, suffixes, and root words so that you can begin to dissect again these terms and try to figure out what they may be meaning when you learn what each of these root words, prefixes, and suffixes actually mean. And again, we'll talk about where you can go in the future. So you heard me mention two terms, descriptive and eponyms. Descriptive terms reflect the actual physical aspects of the body part or the disease of concern. So for example, they will actually describe the color, the shape of something, the size of something, its location in the body, what it's meant to do, its function. The trick is that it's not in English. It is typically in Greek or Latin. So you need to learn a little bit of Greek or Latin in order to know what color, shape, size, function is being described. But once you learn a little bit of that, and we're going to go through that today, you can pretty well learn how to break apart these terms and figure out what they may be meaning, and not just have to memorize them all. Eponyms, however, are derived from names. So they're usually bestowed as an honor to people and for those who might have been the first to discover something, a new illness, an anatomical structure, And usually they are, you have to actually memorize them. They're nothing that you can use your knowledge of a language for to understand what they are, because they're someone's name. So we'll talk about that in a bit. Let's talk about some examples now again. A descriptive term that many of us may have heard of is an esophagus. So this was first used in the late 14th century, and it's from the Greek word esophagus. I don't know how to pronounce it in Greek. I'm not Greek. But that literally means gullet or passage for food. And it means what carries and eats. And that's combined from the Greek words that are, as you can see here, oisin to carry and phagos to eat. So when you put them together, the term they came up with was esophagus. It makes sense. So literally now, if you were to see the word oisin or phagos somewhere, you can think, okay, phagos means to eat. You may have heard of, in biology, the term phagocytosis, which is where a cell can eat another cell. So things like that. And now you'll know what that means if you see that in a term somewhere. So an example of an eponym would be something like the fallopian tubes. So the fallopian tubes are named for Gabriele Falloppio, who's a 16th century Italian anatomist. I'm not sure people out there know what a fallopian tube is. You can't use your knowledge of Greek or Latin to figure this one out because it's named after someone. So what a fallopian tube is, if you don't know, is that's the connecting tube between the ovaries and the uterus. And so that's where a fertilized egg will travel through to get to the uterus to implant itself. So some of the things that are potentially wrong with eponyms is that, again, you need to learn exactly what the term is. You just have to memorize them. There is no way for you to use any kind of greater knowledge or understanding of terminology to understand what these mean. It's just pure memorization. And secondly, because they're named after people, there can be mistakes with that. Sometimes they're named after people who really weren't the first person to describe something. And sometimes they're named after people who history has shown to be have questionable moral character. So currently there's a shift away from eponyms. I want to talk a little bit more about eponyms because most of this talk will be about descriptive terms, as that's what we can learn more about and really advance our knowledge of. Again, eponyms are just more memorization, but there's a lot of them out there still. So fallopian tubes is one example. And here to the left, by the way, is a cover page, the title page of a work by Gabriele Falloppio, Filipino, or he's not Filipino, I made a mistake, Falloppio from Italy. But you can see that they've Latinized his name here in this title page. But thinking about other eponyms, I'm going to give you a moment to think about them, if you can have any other ones that might come to mind. And feel free to put them in the chat too if you do, actually. I'll take a look there too. I'll give you an example of one. Alzheimer's is a classic one. So you know, knowing that name does not help us to figure out what that actually means. We have to know that it's a progressive disease involving memory loss. And it was described first that we know of, by Dr. Alois Alzheimer, who was a pathologist and a psychiatrist in Bavaria. And upon doing an autopsy, and I think 1900, around then, he discovered plaques in the patient's brain and presented on later that year, and then was credited as being the person who discovered Alzheimer's disease. Other diseases, I do see we have a chat item here. Let's see. Oh, the pap smear, that's a great one. Yeah, sure, for Dr. Papanicolaou, exactly. So that's a procedure that was credited towards one of our physicians here at Weill Cornell Medicine, who helps to diagnose cervical cancer, or hopefully prevent it. Great, yeah, so that's another one. Another example would be Parkinson's. That's named after, so that's a progressive neurological condition which limits movement and affects movement. And that was named after James Parkinson of London, England. And he was seen to be the first one to describe that. Some problematic ones, though, that people might have heard of is Reiter's syndrome. So I'm not sure if anyone's heard of that one, but that is joint pain and swelling triggered by an infection. And so usually an infection might happen in one part of the body, but then you might get joint pain, you know, in your ankles or in your fingers. And that's now called reactive arthritis. And that's because Reiter, Hans Reiter, was known after the fact. People didn't realize it when they named this after him, but that he was a participant in Nazi Germany's some human experimentations that were going on during World War II. And so even when that was discovered, people were so used to calling it writer syndrome that it was very hard to divorce his name from that term. So they started calling it, there was a big drive to call it reactive arthritis. But people all knew of it as writer syndrome. So even when it was called reactive arthritis for decades, now it's almost always called reactive arthritis. No one really remembers it as writer syndrome. But up until the 80s and 90s, it was always writer syndrome, formerly known as, reactive arthritis, formerly known as writer syndrome. So the person's name was still continued to be associated with this diagnosis. Was still getting credit for it. And so that's another reason why eponyms are kind of being pushed away. All right, so let's switch over now. So thinking again about descriptive terms, because again, these are the ones that we can use the root, the prefix and suffix and kind of learn these vocabulary to help us kind of get at the meanings. Root words are really the middle of the word. It's the main component of a word. You've heard of this before in English. Prefixes come at the beginning, and in this case, they usually are used as a subdivision of the root word. So if the root word is something to do with heart, it would be, the prefix would talk about a particular component of the heart. And a suffix comes after the word at the very end of the root, and that's really a way to interact and showing what's happening at the very moment with the root word. So these terms can kind of be, so just because something might be in the root in one particular part of a medical term, it doesn't mean always it's to stay there. You can see another term and it might be in the prefix section component of the word itself, of the term. And that's fine. The meaning will always be the same. It will just kind of modify a different term. So let me show you some examples here. Myocarditis. You may have heard of it or not, but let's look at what this actually stands for. So myo means muscle. It will always mean muscle when you see that in a term. Card or cardite means heart, and that's the root word here. And then itis means inflammation. So whenever you see itis at the end of any word, it's going to mean inflammation. So in this instance, it means the heart muscle is inflamed. And that's kind of what you can start to do. Once we learn these terms, we can start seeing, okay, myocarditis, I'm seeing cardiac, heart, muscle. The heart muscle is inflamed. Let's try some other examples now. So thinking about how the prefix changes things up, we're thinking about myocarditis still. What happens when we change the prefix? So we get rid of the myo and we change it to other prefixes. So the myo means muscle, as we've talked about, but what if we did pericarditis? That's the outer layer of the heart. So peri means outer layer, outer component of something. So now it's the outer cardiac or heart muscle is inflamed. Endo means inner. So here we'll have endocarditis, which is the inner layer of the heart is inflamed. And you can see we're changing again the prefix, the root and the suffix remain the same, but we're modifying kind of what part of the heart with these prefixes is being inflamed. Does that make sense? So it's all about just learning what each of these terms mean, and then you'll kind of, we can learn that this all has to do with the heart. Whether or not we know what the myo, peri, or endo has to do with it, we'll know that there's some kind of inflammation in the heart. So already when you hear this from your doctor, you'll know what they're talking about in terms of inflammation. And you can ask them, oh, my heart. So what's going on with my heart again? Tell me what endocarditis actually means. And you'll have some working knowledge of that. Okay, so let's think about suffixes, and we're going to keep going with the cardiac example here. So cardio is the main root we're working on right now. Cardiologist, heart specialist. An ologist means a specialist. Cardiomyopathy. So in here, we've kind of switched things around. Remember earlier on, we had myo as a prefix. Now we have myo as a root, but we're still thinking of here, myopathy or opathy means damage. So here we're thinking the muscle of the heart is damaged. So the pathy means damage. We've learned cardiac again, so we know that's something to do with the heart. You'll learn muscle already too. So something about the heart muscle is damaged. There's also a term called cardiomegaly. When you see mega megaly, anything like that, it's going to be enlargement. Something that was formerly a smaller size that is now larger, it's been enlarged. And so here the heart is enlarged, cardiomegaly. All right, let's think about prefix examples now again. So these are ways that you're going to modify a root word, things that are going to help us to kind of figure out a very particular part of a root. So if you see an a or an in front of a term, that means without or none. So apathy is without emotion, and that's my little Sigmund Freud picture up here too. But there's anorexia, without appetite. So anytime you see that, without, none. Micro means small, like a microscope to see small things. And macro means large. So you've heard these terms before, but in medical terms, microcephaly, small head, and it means circumference, literally. You may have heard of macrocephaly, and that's large head circumference. Cepha, that means head, and we'll learn that in a little bit. That's the root word here. Auto means self, autoimmune disease. It means your immune system, your own immune system is diseased. Now here's mega again, which means enlarged. Megacolon is an example of that. The colon, the large intestine. And an anti, against. We've known the term anti-establishment, anything like that. That's the same thing in medical terms. Antihistamine, against histamines, things that inflame the body. And so if something is antihistamine, it stops the inflammation that's happening in the body. Thinking about suffixes now. These are the end of words. If you see itis, we've talked about that term earlier on, that means inflamed. So tonsillitis, this would be the tonsils are inflamed. If you see something called osis, you'll see that sometimes too, thrombosis, things like that. That means an abnormal condition. So it just means that something is not right with whatever we're talking about, with whatever the root word is. So cyanosis, cyan means blue. So abnormal blue condition is what this would literally be brought to or defined as. You see ectomy, that means to remove. So appendectomy, people have all heard of that. Tonsillectomy, remove your tonsils. Ectomy means to remove. Graphy or graph, so that means to record an image. So mammography, recording an image of the breast. Oma, now here's one that people often, you may hear as being lipoma, things of that nature. And that really just means swelling at this point. It doesn't necessarily mean cancer. It's related to tumors, but it refers specifically to swelling. So ostoma is a bone tumor, that means swelling on the bone. These two are a little confusing to people. You may have heard of otomy or ostomy. So things such as a tracheostomy or a tracheotomy. Basically, an otomy is when you're cutting into something temporarily, and an ostomy is to make a mouth and to make something permanent. So an otomy, if you hear like a tracheotomy, is somebody can't breathe. They need to put in a breathing tube, and for some reason it can't go into their mouth, it has to go into their neck, but it's just temporary. That would be an otomy. But sometimes people have to have tracheostomies, and they permanently have to breathe through tubes through their necks for particular reasons. And that would be a tracheostomy, meaning it's a permanent opening that they've made. And there's also colostomies, which you may have heard of too, which would be a permanent opening for the bowels. Yeah. So what else are we on here now? Scopic. Yes, scopy is literally to look or observe. So you might have heard of colonoscopies. What else is there? Any kind of oscopy that you may have to go for. Bronchoscopy. That's literally to scope the bronchioles. So scope the colon. Yeah. And then lysis or lytic, which means destruction. So if you see lysis after something, it means something is being destroyed. Okay, let's talk about root words now, because the prefixes and suffixes all relate to these root words here. Do you see something like stomato is mouth, dento, dentist, teeth, glossio or lingual are related to the tongue. Cephalo is head. Encephalo is brain. And think about that. En is actually in. So in the head is the brain. And in this point, or this part, I've got a term here, encephalitis. So you may not know what that is, but just by what we've talked about today already, the brain is inflamed. Encephalitis. Gastro has to do with the stomach. Entero is a small intestine. Colo or colon is the large intestine. Procto has to do with the anus or the rectum. Hepato has to do with the liver. Nephro or renal, kidney. Orchio is testes. And oophorectomy is ovaries. And this would be removal of the ovaries here. And anything with metro or hystero are uterus connected. So hysterectomy, removal of the uterus. All right, let's continue on. So dermatologist, that would be a specialist who studies the skin. Masto or mammo is breast. Osteo stands for bone, osteoporosis. Cardio, we've seen that several times today already, the heart. Cysto, that's your bladder. Rhino, nose. That one I always think is interesting, how, the rhinoceros was named for what they thought was their nose, their horn. Interesting. But vasc is blood vessels. And then anything with flebo or veno means the vein specifically, not just the general vascular blood vessel system, but veins. And that would be like phlebotomist. And that would be, a specialist who draws blood from your veins. There's pneumo or pulmo, which have to do with lungs. And then hemo or emia, which have to do with blood. Emia is a suffix, but I put it here just because it goes closely with the hemo in meaning blood. It's one of the suffixes that can actually mean a particular kind of part of the body. All right, so some other terms that you may hear of or see out there that are good to know, so you can start to break apart these terms and learn what they might mean. Tumor-related terms. These aren't solely related to tumors, but you might see them with tumors. For instance, lipo doesn't have to do with solely with tumors, and that means fat. Adeno or adin has to do with the gland. Again, we've talked about myo before, which just talks about muscle. I mentioned mia briefly, that has to do with blood. Lymph or lympho, that has to do with the lymph tissue. So the lymph tissue is what helps to drain things out of the body, and it's a separate system from the vascular system, but helps to remove waste out from the body. And then there's carcino, which is malignant. Color terms. So sometimes you might have something called leukoplasia or cyanosis, as we saw earlier. Leukoplasia, you'll know something has to do with white. Cyanosis is blue. Melano means black. Xantho means yellow. And then ruby or rubio is red. Rubella, I think that means little red. And so that's because of the red rash that often develops with rubella. All right, so some terms have to do with directional, where things might be in the body too. Endocarditis we talked about earlier, and endo means inner. So here is endo, within, inside of. Peri is around, outside of. Circumference also means around, or circum also means around. Retro is behind something. So retrosternal would be behind the breastbone, which is the sternum. Epi means on top of something. Epidermis, the top part of the skin. Derm means skin, and epi is the top part of it. There's like several layers of skin, if you didn't know that. I think there's 7 or 8 or something. I don't remember particularly. But there's trans, that means actually through something. So transluminal, through the lumen, through the vascular system. Intra means within something, so it goes inside of it. Intravenous would be in the veins. And then sub means below. So that would be something like a subdural, below the dura of the skin, which is the layer of the skin. All right. So that's actually what I have for today for you. I know what I went through was a lot. It's really just meant as an introduction. And Judy, I wonder if we could, I'm happy to share these slides if you can do that later on and send them to people who are interested. These are the resources right here. Again, the Des Moines University Medical Term Course, www.dmu.edu/medterms is really nice, and it's made for beginners. So if you found this interesting and you want to learn more, you can take this for free. You don't need to pay anything. If you wanted to get a certificate out of it, I think there is a small fee to get a certificate. But if you wanted to do it just for fun and to learn, you don't need to register for it or anything like that. You can just take it. When we have new folks come here in the library, we often have them take this medical term course just to get up to speed with what they may be hearing out in the clinics. So I recommend that you as a patient go and do that too, because it's a really great way to kind of gain some working knowledge of medical terminology and to hopefully have better discussions with your provider. Also, these are some other dictionaries, and Medline Plus is a wonderful place to go if you haven't been there to find more information about healthcare in general, healthcare terms in general. Yeah, so hopefully we can make these available, Judy, somehow to the folks who might be interested. But
Certainly.
that's all I have. Okay, great.
Yes,
That's actually all I have for today.
Keith, thank you for this wonderful presentation. And it is recorded and will have a home. I'm not sure exactly where it's going to be, but I can send it around to anyone who wants to have a copy of it. And I think we'll probably try to put it on our YouTube station. And then, of course, it will have a home somewhere in the library, I believe. So
Great.
I need to talk to Diana about where things like this should reside.
Great.
Great job. Thank you very much for doing this, and really appreciate it, and appreciate everyone coming in and listening.
Yeah. Thank you all. Yeah. Hopefully you learned a little bit out of it. I didn't overwhelm you all, but it's really just more about getting comfortable with the terms and then knowing that you can break apart those terms yourself and learn and have great educated guesses at what the doctor may be speaking about. Of course, you can always ask them directly too, but sometimes you can use these little tricks to try to get ahead of the curve.
Yeah, well, doctors, they speak the language they know, and this is how they talk.
Yep.
And so knowing a little bit about it really can put you ahead of the game and
Yes.
help you when you go visit them. So
yep.
Thank you
Can
very
be much more comfortable. Great.
Yes.
Great.
Good job.
All right. Thank you all. Yeah, of course.
Thanks everyone for coming and attending.
Bye all. Take care.